Hi, everyone. Welcome back to all my listeners. This is episode 14 in season 16. Today is Wednesday, December 3rd, 2025. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. All right, you guys. Well, welcome to a brand new month of December. Well, on November 30th, I got over 8 inches of snow. It was a complete mess out here in Chicagoland. Everybody was just trapped indoors, staying cozy. So it was a lot of snow out here in Chicagoland. And as I'm recording this episode, it is snowing some more. So I think we're in for it. I'm looking forward to escaping in a few days. I'm going down to the NAMUS conference in Savannah, and I'm always looking forward to that conference because it is where all of the expert auditors and compliance professionals go to get their education. So I'm going to be sponsoring a session down there, as well as the lanyards. I just love supporting the organization in any way I can. If I'm not speaking, I want to help sponsor it. So that's what I'm doing this year based on my schedule. So looking forward to getting out of Dodge for just a couple days, maybe a little bit warmer weather, although I think Savannah is going to have some rain. But anyway, it's going to be great to see all of my wonderful colleagues again for a couple of days and then just enjoy the beautiful city of Savannah. They always have it decked out for Christmas holidays. Everything is decked out in either blue or white or red and green, just depending on how the hotel and the city is going to be feeling festive. So I cannot wait. I'm looking forward to it. But welcome to the month of December. Today's episode is going to be a quick one, but I really wanted to focus just a couple days ago on December 1st was a very important day. It was World AIDS Day on December 1st. So I really want to just talk about that briefly in my Newsworthy and shine my spotlight on such a critical day. And then in my Trusty tip, I want to focus on a new Hospice Outpatient Services edit that just came out, and it will be effective in a few months. But for all of us in that space, it's really important for us to get our act together and start understanding what is going to be needed before that Hospice Outpatient Services edit takes place. And then, of course, I'm going to be going ahead and closing out and rounding out today's episode with another remarkable quote on resilience from Marcus Aurelius. All right, you guys, let's get into it. So in today's Newsworthy, on December 1st, 2025, the World Health Organization joined partners and communities to commemorate World AIDS Day 2025. And of course, this year's theme is overcoming disruption, transforming the AIDS response. And all of these organizations are calling for sustained political leadership, international cooperation, and human rights-centered approaches to end AIDS by the year 2030. Now, after decades of progress, the HIV response stands at a crossroads. Life-saving services are being disrupted, and many communities face heightened risks and vulnerabilities. Yet amid these challenges, hope endures in the determination, resilience, and innovation of communities who strive to end AIDS. Now, WHO, of course, puts out great statistics. Now, they claim that in the year 2024, an estimated 40.8 million people were living with HIV globally. Further still, approximately 630,000 people died from HIV-related causes in 2024. Also, an estimated 1.3 million people acquired HIV in 2024. Now, the WHO includes key messages for 2025, and they include to prioritize and integrate, to address inequity, to scale innovation, and to empower communities. So let me break it down a little bit further. Key messages for prioritizing and integrating. The HIV response is shifting, offering a vital opportunity to reset by simplifying and prioritizing access to HIV prevention, testing, and treatment. Also, by strengthening management of drug resistance and advanced HIV disease, and by integrating these services within a primary healthcare approach that includes strong community-based services. Now, the WHO also claims that countries can reach more people in need with holistic services, sustaining gains, and building resilient health systems that serve everyone everywhere. Now, the WHO also includes the key message for addressing inequity. Ending AIDS means addressing the inequalities that drive the epidemic. Children and adolescent girls and young women face heightened vulnerabilities, particularly across the African region. And key populations, including men who have sex with men, trans and gender diverse people, people who use drugs, sex workers, and people in prisons in all regions face increased HIV risk. Protecting rights and ensuring access to services for everyone is essential to stopping new infections and achieving health equity. Now, the WHO also includes scaling innovation. The fight against HIV has never been easy, yet resilience and innovation continue to define the response. As global funding falters, advances like 6 monthly injections to prevent HIV remind us that progress continues. With commitment and creativity, we can ensure that life-saving, long-acting antiretrovirals for prevention and treatment reach those in most need. And finally, another key focus from the WHO is messaging for empowering communities. Communities are the driving force of the HIV response. People living with HIV and those most affected, including key populations, bring the insight, the courage, and the innovation needed to overcome today's challenges. When these communities join forces with health workers, policymakers, and partners, new pathways to success emerge, built on trust, equity, and shared purpose. And now it's time for my best practice tips in Trusty Tip. Now, there's a new MLN Matters article that came out specific to outpatient services for hospice patients. Now, there's a new edit that will become effective April 1st, 2026, and it will be implemented by the MACs on April 6th, 2026. Now, affected providers include hospitals, hospices, as well as other providers billing Medicare administrative contractors, the MACs, for outpatient services. Now, what actions are needed? Make sure your billing staff knows that, number one, these new systems edits will compare primary diagnosis codes on hospital and hospice claims for Medicare hospice patients to prevent duplicate payments. You also need to be aware of how to properly use the condition code 07. Now, what's the reason behind this new edit? Well, the background includes the fact that the OIG, the Office of Inspector General, audited Medicare Part B claims for outpatient services acute care hospitals provide to hospice patients. Now, the OIG found that Medicare improperly paid an estimated $190 million over 5 years to these hospitals for outpatient services related to the hospice patient's terminal illness and related conditions. Now, CMS already covers these services as part of the hospice per diem payments. Hospices should either directly provide these services or provide under arrangements with acute care hospitals. Acute care hospitals have improperly billed using condition code 07 on outpatient claims, indicating the outpatient services were not related to the patient's terminal illnesses and related conditions. Now, key updates from the CMS. CMS is enhancing the current system's edits to help reduce improper payments for outpatient services provided by acute care hospitals to hospice patients. CMS created a new edit to automatically compare the outpatient claims primary diagnosis codes with the hospice claims primary diagnosis codes by doing an exact diagnosis match. This edit will deny hospital inpatient and outpatient claims when there's a hospice claim for the same Medicare patient within the same covered period with condition code 07 or modifier GW with the same primary diagnosis. So I thought that was a really great update that the CMS is creating, or they have created and will be implementing this new edit. It just goes to show that these OIG reports are really, really high level findings, right? And I always appreciate when CMS agrees and they realize that they can do something. They can make a correction by creating a edit, right? And in this particular case, when there's a hospice patient and there's a crossover between outpatient services in the hospital setting, as well as the hospice claims that are going out, it is based on those diagnosis codes, right? And clearly the OIG identified in multiple reports from the past that these are overpayments that they are identifying. There are duplicate reimbursements that are being made for these types of hospice services. So I really appreciate the fact that CMS has taken time to review all of these findings, and they have created an edit that will be taking effect on April 1st, 2026. And the various MACs around the country will be implementing everything by April 6th. So keep all of that in mind. Start taking a closer look at your hospice claims as well as your outpatient services for your hospice patients and see what is going on internally as well. But I really loved this MLN Matters that was just issued for us to stew on for the next few months and make sure that things are going to be done properly and prevented the duplicate payments that have been going on for so long, right? In the millions of dollars, $190 million worth over the past 5 years in terms of improper payments. So this is a really, really good finding. And I can't wait to see the proper and more appropriate payments that will be made based on this new edit. And finally, I focus season 16 Spark on resilience. I want the 16th season Spark to be filled with our world's thought leaders, writers, artists, philosophers, everyone who inspires us with their statements involving resilience. So, in this week's inspiring quote in Spark is from Marcus Aurelius. You have power over your mind, not outside events. Realize this, and you will find strength. Absolutely true, right? This quote says it all. We are reminded about our power. So often we forget that we each have it. Hold it, honor it. Your power lies within. You do not let the noise distract or persuade you. Your focus makes the difference. I'm happy Marcus Aurelius' spark still burns brightly and can continue to inspire so very many. All right, you guys. Well, that wraps up today's very short and sweet episode for the month of December. It's the very first week. I know there's a lot in store in terms of gift giving, the holiday season, cookies to bake, trees to dress. Oh my goodness, there's so much fun that is in store for this particular month. I know a lot of us have a lot for our businesses that we have to consider as well as we plan for the new year. I also have some updates as well, which I will be revealing, unveiling, whatever the terms are, by the end of the month. So I've got lots to share as well, but I really do hope that everybody in my audience is going to take time this entire month to be grateful and be thankful and definitely grace your homes with family and friends and make sure you eat really, really healthy and remain stress-free during this holiday season. So, all right, you guys, thank you so much for listening on today's episode. And I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday.